Hi, everyone. I'm Jessica Abo coming to you today from Los Angeles. And today we are talking with Cy France. He is a medical doctor and a serial entrepreneur of healthcare startups. Cy, will you start by telling us a little bit about your journey?
I was in medical school at Dartmouth. And what was interesting about it is I was there at a time when there were all these doctors doing this kind of groundbreaking work on understanding how healthcare works. So, if you're at some medical schools, the famous doctors are the heart transplant surgeons or the big infectious disease doctor. I was at Dartmouth whenever, Elliot Fisher coined the phrase accountable care organization, which is like the future of how healthcare should be designed. I got exposed to all these doctors who were working on how to change the healthcare system and what was broken about the healthcare system. And then it was in business school, I saw all these ways to go fix it. Entrepreneurship, investing, through all of that, I just felt this huge sense of inspiration and calling to dedicate my career as a doctor to improving healthcare as like a mission-driven change agent in healthcare and to do that as an entrepreneur.
Mission-driven change agent in healthcare. I love that. What was your first healthcare venture?
I stumbled on this opportunity to go create these like really great, high-quality urgent care networks for major hospital systems in a joint venture model, and that became the first company I started, which is GoHealth Urgent Care. After a few years of doing that, we grew really fast, and I learned a lot about how to start companies. It left me kind of questioning at the end of that because it started this business plan business, and I was like, did I really give up a career as a doctor to go be a healthcare capitalist? The whole reason I went on this journey was to go be a mission-driven change agent. Now that I know how to start a company, what would that look like? And it just was so clear to me at that time. I wanted what became Welbe Health. I wanted it to be about two things. The first was it wasn't about a business plan. It was going to be about a culture. I wanted to go create this organization where people weren't resources in some kind of capitalist plan. We cared about people. And then the second part is that culture, that organization would then serve the most frail and vulnerable seniors. Because I had learned in medical school, the things that most need to be fixed in healthcare are how do we go serve the highest utilizers, the most frail and vulnerable seniors with better coordination, with better compassion, with aligned incentives around their health. And so I wanted to go create this value-based care model that dramatically improved care for the most frail and vulnerable seniors, not through a business plan, but through creating this force for good, this culture. All of our employees are cared for because we see them through the eyes of their loved ones and care about them and have reverence for their humanity that way. And then we can do the same thing for our patients.
How does Welbe Health work?
So we decided to go build this whole model around this program of all-inclusive care for the elderly. PACE cares for people who are poor enough for Medicaid, old enough for Medicare, and sick enough to live in a nursing home, which has 24/7 nursing care. They qualify for a state-funded nursing home level of care. So the state will actually pay for them to live in a nursing home. That's how sick and frail they are. But yet they don't live in a nursing home. They still live at home. The beauty of PACE is that they enroll in our program and that we provide 24/7 all the medical and social services that they need fully coordinated around the clock with the goal of keeping them healthy and living at home. When someone enrolls in PACE, their life expectancy increases by 1/3. Depression rates cut by 80%. ER days plummet and they live at home instead of a nursing home. Family member satisfaction skyrockets. It's like the most amazing program. And yet, for 40 years of PACE, you only had access if there was a PACE in your community. And so at Welbe, what we decided to do was just go rank communities by largest unmet need. The largest unmet need, which is the most people eligible for the program with no access to the program, was in Stockton, California. So that became our first market. The second largest population of unmet need was Pasadena. So that became our second market. The third was Long Beach. So that became our third market. We just went where the need was greatest.
What advice do you have for an entrepreneur who wants to be like you and be a mission-driven change agent?
One of the most important things that I've learned is being crystal clear on what you stand for. The most important thing to know about business is that it's just a group of people you're trying to organize to go accomplish a common goal. That's all it is. These are human beings here. You just got to organize people around a common goal. If the goal actually can be something that's like much bigger, it's about serving a cause that's much bigger. It's so much more inspiring. So many more people want to join you on the journey. And so that's where I've, really gone from the conviction of thinking that, I had to go start a business plan to thinking we're going to go create a force for good in the world. And kind of once that snowball starts going, it's like the greatest possible initiative I could imagine being able to go do something like that.